My name is Amy. I'm the intern pharmacist. Can you verify your name and date of birth?
Hi Amy, my name is Oscar Sanchez. My date of birth is 8/31/59.
Okay, great. Do you mind if I go over the medications with you?
Go ahead.
Okay, so part of your medication list includes pantoprazole, 40 milligram, 1 tablet by mouth twice a day. Usually you take that for 2 to 3 months. What it does is it lowers your acidity in your stomach to prevent acid reflux, so you don't get the chest pain like you did before. And it is best to take it empty stomach 30 minutes to 60 minutes before your breakfast, and then also at night before your bedtime. And some of the side effects include osteoporosis if you're taking it for a long-term use. And we're changing your blood pressure medication, and we're stopping your procardia because it's not like a recommended drug for your disease state. Since your blood pressure is uncontrolled, we're going to add some new blood pressure medication. And so we could get you down to less than 140/90. And because you were on lisinopril 40 milligram, 1 tablet PO daily, we're keeping that, so you're taking the same direction and same strength. And it's for your blood pressure, and you could stop the medication if you notice any swelling around the lips or dry cough. And we're also adding a atenolol 25 milligram 1 tablet PO once a day, and that also lowers your blood pressure by reducing the work done by your heart. You don't want to stop this medication abruptly because it might cause your blood pressure to shoot up too suddenly. And we're also going to add a hydrochlorothiazide 25 milligram 1 tablet once a day. So what it does is it works in your kidney to get rid of excess water, and also lowers your blood pressure like the other like the other medication. And it also increases your frequency of urination. So you want to take this medication in the morning to avoid waking up at night to use the bathroom. And you want to report any allergic reaction as well. So for this, you want to follow up in 2 weeks to check your blood pressure and also to get your blood drawn. So the change of medication might cause some dizziness from the drop in blood pressure, so you want to take it easy until you know how you feel on the medication. So I've gone through a lot of information with you. So what concern or questions do you have for me so far?
So that was a lot.
Mm-hmm.
Let me see if I get it right.
Okay.
So you're giving me pantoprazole, which is, I take it in the morning before breakfast,
Yes.
and that's for my acid reflux.
Mm-hmm.
And then we're keeping one of my blood pressures the same.
Oh, so for pantoprazole, you want to add, because it's twice a day, so you want to take it once before breakfast and then once at night.
Oh, so it's 2
before
times.
bed. Yes.
Okay.
Uh-huh.
And then lisinopril is the same.
Mm-hmm.
We are doing atenolol, you said?
Yeah, so we're adding atenolol 25 milligram.
And that's once a day.
Once a day.
And then hydrochlorothiazide, which you said take it in the morning because I will go to the bathroom more.
Mm-hmm.
Okay.
That's correct.
Sounds good to me.
Okay, good. And I'm going to continue a list of meds of Lipitor for, it's torvastatin 40 milligram, 1 tablet, so you take it by mouth once a day. What it does is lowers your cholesterol. So because you were on 10 milligram, it was a little low on the strength. So with your age and your risk of heart disease, we're increasing it to 40 milligram instead. And you want to report any signs of unexplained muscle aches or dark brown urine. And for this, you want to follow up in 1 month for your fasting lipid panel and to get your blood drawn. And because since you have experience bleeding from Motrin before, we're going to discontinue that and give you lidocaine patch 5% instead. And for that patch, you want to apply that daily on your lower back area, 12 hours on and 12 hours off. So for pain, so it will numb the area, so you want to be careful not to overexert yourself because it might cause more injury to it. And you want to avoid applying heat packs to the area. And you also want to avoid putting on any broken or irritated skin because it might worsen it. And so for storage of all the medication, you want to put it in a cool, dry place away from the sun. And if you missed a dose, you could take it at the next scheduled time, but make sure not to double up. So I've also gone through a lot more information with you. Do you mind repeating the lidocaine, a new medication we're dispensing you?
Okay, so the lidocaine, you said it was a patch,
Right.
and I put it on my lower back where
Mhm.
it hurts for 12 hours, and then I take it off for 12 hours. And you said I shouldn't apply it to broken skin
That's
and
right.
not to overexert myself.
Yeah, because broken skin would cause irritation.
Okay,
Okay, great. What other questions do you have for me?
I think we are all good. Thank you so much.
Okay, thank you. So if you do have any other additional question, you could contact your physician or the pharmacy.
All right.
Thank you.
Thank you.